On September 7th, 2018, rapper and producer Mac Miller tragically passed from an accidental overdose just 1 month after releasing his fifth studio album, Swimming. Mac Miller unfortunately took oxycodone pills that were unfortunately and unknowingly laced with fentanyl, which, according to the DEA, is a potent synthetic opioid that is 100 times more potent than morphine and 50 times more potent than heroin. The CDC reports that over 150 people die each day from overdoses from synthetic opioids such as fentanyl and its other derivatives. Now, in order to reduce the number of these accidental overdoses, more education, resources, and prevention strategies is essential in communities. With illegally produced fentanyl and other synthetic opioids on the rise, this is making other drugs cheaper and easier to produce and distribute when they're cut with other commonly used drugs. Now, this is essential. We need to be proactive about education and resource availability in order to protect the health and well-being of our community members. First, let's look at some statistics of synthetic opioid overdoses. Fentanyl is becoming increasingly more prevalent in cocaine and heroin, which are commonly used drugs, and this lacing is unknowing and it's becoming cheaper, so it's easier to distribute. In a 2019 review by Hahn et al., they reported that there were over 19,000 overdoses in 2016 from these synthetic opioids, and this number has been increasing by 88% each year. In 2021, the DEA reported that there were 68,000 cases of overdoses from fentanyl and its derivatives, and this is where we get that number of 150 each day, which is incredibly scary. Now, although fentanyl is used in health services and can be a very beneficial pain reliever when it's produced from pharmaceuticals and trusted sources, it's the illegally sourced and produced drugs that are becoming more prevalent and are incredibly dangerous. Local cooks are becoming more common in making this drug, and they're cutting it into pills, cocaine, and heroin, which is how it's getting into the communities. It takes only one supplier or dealer to fully infiltrate a community. Now, the statistics are good in emphasizing this issue, but it's important to also look at the sources of this problem. Now, this does not just impact celebrities and drug addicts. Most users and most victims of opioid, specifically fentanyl, overdoses are unknowing that this was ever ingested and ever put into their drugs. So dealers are lacing it and you just simply do not know that it is in there. Whether you are knowing or unknowing that you are taking fentanyl, it has a very high reward in pain relief and euphoria, sense of euphoria, which makes it incredibly addictive at such a low threshold. Now, there's a really narrow range from an effective to a lethal dose, and in that same 2019 study, Hahn et al. Reported that's a very small amount to overdose, around 2 milligrams, which is completely undetectable in a lot of things, and that's why it's so dangerous. Now, although this is a very serious issue, there are some steps to take to reduce the spread and the influence of this issue. The CDC recommends implementing evidence-based strategies by community leaders, public health organizations, and law enforcement. And the Department of Health and Human Services also recommends the implementation of preventative programming, harm reduction, and recovery support as it has worked for addicts in the past. Now, also, we can lower the cost of testing kits, as some people already use them, but having them more easily distributed and available can help reduce the accidental overdoses. Along with health services, education is just as important, and the CDC also really recommends targeting naloxone distribution and resources, as these life-saving agents need to be more available in communities, and it's important to be able to recognize and help when you see an overdose. Now, it's really easy to become distant from this situation. We think, oh, this will never happen to us, but it's important to show compassion to people in crisis. And since it's so common and people are unknowing, it can happen to anybody at any time. Now, we can discuss solutions, but it's essentially important to get lawmakers and community members on board with this so that we can encourage more resources and support for addicts, and to hopefully also stop the distribution and synthesis of this drug. Now, protecting the health and lives of individuals is essential, whether they're an addict or not, so I encourage you to spread awareness on this. Thank you.